When analyzing a person's running gait, it is very important to use a video camera to be able to slow down the movement and look at the body's posture at different portions of the gait cycle. As we can see from this sample video, trying to do so with just simply watching the person move and trying to estimate where the point of contact is occurring on their foot and what their knee angles look like and other aspects of their joint kinematics becomes very difficult because the angular velocities are so high. This becomes much easier when we're able to slow the video down. Now, to be able to do this without getting a lot of blurring that can sometimes happen with video recordings, it's important to use a high-speed camera for running motions or other sporting type movements. This camera and this recording was done at 120 frames per second. Most video cameras record at only 30 frames per second, so this gives us 4 times as many frames to be able to assess the body's posture with very little blur being present. So if we start with initial contact on that right limb, we're going to freeze our video at that point. And again, we can see a very sharp and distinct heel strike with this individual. And again, this is estimated by the foot inclination angle, where we would bisect, or rather orient a line to the sole of the shoe, excluding the toe area, and then looking at that angle of that line relative to that of the treadmill or of your surface. So this gives us an idea of if we have a positive angle, in this case, would be a rear foot strike. If both the forefoot and the midfoot, rather the forefoot and the heel were making contact at the same time, would be a midfoot strike. And if contact was occurring on the forefoot area only, then we would have a forefoot strike. In rear foot strike runners, the amount of knee flexion at initial contact is rather limited, with the angle being roughly 10, 15, maybe as much as 20 degrees at the point of contact. As we advance our gait cycle, notice the foot comes in full contact with the treadmill surface. Our center of mass reaches its low point at mid-stance. We have increased knee flexion all the way until this point. So again, if we compare the amount of knee flexion at initial contact to what we would see at mid-stance, there is a substantial increase, which is an important aspect of the running cycle, as the knee is one of our primary energy absorbing structures during running. That is, the muscles surrounding and supporting the knee, such as the quadriceps, play a large role in absorbing energy that occurs during the initial half of the running stride cycle. As we advance past mid-stance through our push-off, again, we have our heel rise occurring, indicating the start of pre-swing. We have plantar flexion internal torque with ankle plantar flexion occurring. So therefore we know we have energy generation present and driving this individual forward into their next stride, but also noticing the vertical displacement that we see of this runner. I'm going to advance this forward so you can see it on another right stride cycle. Center of mass being at its lowest point, and I'll leave the arrow indicating where that point is at mid-stance, all the way through to mid-flight. So when both feet are off the ground, Notice again where his shorts line is and how much vertical displacement he's demonstrating. Running will have more vertical displacement than walking. And we also know that the amount of vertical displacement of the center of mass is related to the amount of running economy the person displays, such that a certain amount of vertical displacement is expected and normal. But if it becomes excessive, then we get concerned about the person showing poor running economy. Other aspects of the body's posture during running that we want to look at is the amount of trunk rotation in the transverse plane. This is not something that we can directly see with our camera very clearly, but we need to infer it as best we can from the sagittal plane. The distance that the elbows get behind him and how his chest opens and closes with respect to our point of view allows us to appreciate the amount of transverse plane or horizontal plane rotation occurring at the trunk. When a forefoot strike pattern is adopted by the runner, you'll notice that the joint kinematics and vertical displacement of the center of mass can change quite a bit. In this case, our runner again is making contact on his forefoot, as we can see where the point of initial contact is. Heel is off the treadmill surface. The knee is still fairly extended at this point. And as he advances in the gait cycle, the heel drops down to make contact. He flexes at his knee joint. And the remainder of the gait cycle is fairly consistent with that of a rear foot striker. For runners who land on their forefoot, this allows the ankle plantar flexors to be used to help absorb energy at the ankle joint. So by landing on your forefoot, the ground reaction force will pass anterior to the ankle joint, inducing an external dorsiflexion torque. The ankle plantar flexors then produce an internal plantar flexion torque to eccentrically control the lowering of the heel down to the treadmill surface. As a result, the ankle takes on a greater role in energy absorption compared to that of a rear foot strike runner.